My name is Dr. Mark Lewis. I'm the Director of Gastrointestinal Oncology at Intermountain Healthcare. So my entire work revolves around cancers of the gut and their treatment. I'm not just a physician, I'm also a patient. And in fact, my first day of training in oncology, I realized I had inherited a cancer-causing mutation from my father. My father died when I was 14 years old, and it was only as I was starting my own fellowship that I realized this was a hereditary condition. In my career, I started out treating every type of cancer. I realized, largely through my own experience as a patient, that I really am interested in cancers of the gut. That's what's affected me. And so I want to treat almost exclusively this patient population. So for the last 5 to 6 years, I have treated only GI cancers, which includes gastric cancer. So from that moment on, I wasn't just an oncologist, I was also a patient. So I've had several surgeries at this point, and I have learned just how important it is in oncology to partner with other specialties like surgery, sometimes radiation, and figure out what is the right treatment for the right patient at the right time. And it has allowed me to continue in my work and maintain a very good quality of life. Gastric cancer is another term for stomach cancer, and there are more than 25,000 cases in the United States every year. Obviously, it's an organ of the upper GI tract, and it's incredibly important for digestion, but it can become malignant. And risk factors include obesity, smoking, and then a bacterial infection called Helicobacter pylori. So only about a third of patients diagnosed with gastric or stomach cancer will be alive at 5 years. It's a pretty brutal milestone, and only a tiny fraction, maybe about 6% of patients with gastric cancer will survive if their cancer spreads outside the stomach, metastasizes, again at that 5-year milestone. One of the things that's really interesting and striking about gastric cancer is that the pattern varies across the world. It's actually far more common in Asia. We also see it a bit more in Central America. And we've actually learned from our colleagues in those other countries how to manage it here in the United States. In terms of the symptoms of gastric cancer, some of them are actually common. So a lot of people have heartburn or upset stomach. Thankfully, only a minority of people with those symptoms actually have a cancer. Again, either affecting the stomach, the esophagus, the tube leading to the stomach, or the junction between the two, what we sometimes call the GE junction. So at that junction, if acid is coming up from the stomach into the esophagus, that's reflux, and people can feel that as heartburn. But as the cancer progresses, other symptoms can emerge. So nausea and even vomiting, sometimes vomiting blood can occur. And as you might imagine, based on where this cancer is located, weight loss is very common because it's both harder for the food to descend into the stomach and be digested, and also the cancer itself, as it grows, can consume calories from the patient.